What's up, everybody? You are listening to the Strength and Knowledge Podcast. This is Dr. Zach Baker, and I have with me Dr. Tyler Betteridge, one of our two sports residents who operates out of our Germantown location. And he's going to be going over a recent research article related to the hip, because that's the topic that we're overseeing in the sports residency right now. And this one has to do with the adductor muscle group, adductor injuries, and how and if we have a way to either predict the likelihood of them or any correlation between testing and performance. So, Tyler, do you mind telling the listeners what was the title of the article that you found?
Sure. Buckle in, because this is a mouthful. It's the Development and Predictive Validation of the Brazilian Adductor Performance Test for Estimating the Chance of Hip Adductor Injuries in Elite Soccer Athletes.
You weren't joking. That was a mouthful there. With adductor injuries, these can be tricky in the clinic because it's a large muscle group, but they have a variety of functions. Obviously, they have adduction, but you have some that are a little bit shorter lever, some that are a little bit longer lever. It can be difficult to find something that isolates the muscle group that we are looking to get after, and it can be even more challenging to find some sort of functional test that captures really their ability, either just from a baseline standpoint of what they're capable of doing and what they're able to tolerate, but then also finding something, relatively strenuous enough that's going to mimic or have some sort of correlation to what we're asking them to do in sports. Now, obviously, with a field or a court sport such as soccer, the best way to assess readiness is taking them through actual soccer motions, letting them practice, progressive play, getting them involved in drills, doing sport-specific tasks. But we need to have some sort of test or measure prior to all of that to see if we're even in a logical position to put them in those positions in the first place. So before we get into the article, Tyler, do you mind just talking about what the Brazilian Adductor Performance Test is, just so people can kind of visualize what that looks like?
Sure. So basically the BAPT, or the Brazilian Adductor Performance Test, is a Copenhagen side plank lift max rep test. So for those of you unfamiliar with a Copenhagen side plank top leg, they had it placed on a half-meter box or a half-meter bench. Top leg is straight. Your bottom leg is not resting on anything. And then you were in that side plank position with the elbow bent, elbow directly underneath the shoulder. And the way they performed the test was the athletes would control themselves to the ground, touch the ground, and then raise back up into the starting plank position. And the test was done for max reps.
Cool. And within this study, they'd reported 1 in 5 male athletes at the elite level will suffer an injury to the adductor group. Remember, we're talking about elite soccer players. So this BAPT test, they're trying to figure out, is this a cost-effective, objective measure of adductor strength that can be useful in either the evaluation, the treatment, or the injury identification or prediction strategies associated with this certain demographic? So, Tyler, do you mind getting into what the actual study looked like? Who was involved in this study? What was the trial design? And then ultimately what they found?
Sure. So they had 108 male soccer players from an elite Brazilian soccer team. They didn't specify which team it was. They were all aged 18 to 40, and this was during the years 2019 to 2021. The participants completed all their preseason and interseason functional testing, and they only included athletes who had actually competed in games as well. Athletes that were excluded were athletes that had pain while trying to perform the BAPT, as well as people who had sensitivity with palpation of the adductor or pubic region. They had a positive 5-second squeeze test, so your isometric adduction test. If they had confirmed COVID-19, clinical signs and symptoms of prosthesis or urinary tract infection, or other orthopedic conditions that could affect the hip or the knee. And then they kind of left out any of the guys on the team that were kind of at the end of their contract or got injured during that follow-up period. The way they set up the study, it was kind of like a 2-part study here. They looked at 6 months prior to taking the BAPT test and looked at the injury history of all the athletes to see if anyone had any occurrence of a adductor type injury to see if the BAPT was a predictor or an identifier, rather, of a previous recent injury to the adductor group. And then the second part of their study looked at 3 months following the BAPT to see if BAPT could be used as a predictor for future injury.
Cool. And then with this, what were they looking for? What did they end up finding as some of the results?
For sure. So in this study, so they had all the athletes take the BAPT, and in that 3 month follow-on period after the BAPT test, 15 adductor injuries were identified. They have identified this by MRI imaging and also consult with physician and PTs. They found that the athletes who were injured their adductor group were also the athletes that scored significantly lower on the BAPT test than the uninjured athletes. And the number that they kind of settled on was those who scored less than 33 repetitions in that max lift test had an increased likelihood of injury by 20%. And then in regards to the retrospective part of the study, where they were looking at the past 6 months history of adductor injury, they found that the BAPT really wasn't a good identifier for previous adductor injury.
Cool. So when we get to all this, and when you look at things from a research standpoint, there's some things that are relatively conclusive. There are some things that are inconclusive. And there are some things that they're inconclusive, but there's still some sort of takeaway from it, meaning maybe we couldn't capture it with the data. Maybe we couldn't capture it with statistical significance, but we do still think that there's something meaningful that we can take from this. Reading this article, seeing what they found, becoming more familiar with the BAPT test, which was one, admittedly, I was unfamiliar with prior to seeing this article. What are your big takeaways that you get from this article? What are things that you could see yourself utilizing in clinical practice after being exposed to this?
Sure. So I liken this test kind of to our anterior step down that we'll do for any of our lower extremity injuries. We're looking at kind of a functional endurance and control test where we can see if the tissues that we're loading have the adequate capacity to progress into our next phase. Like you were speaking on earlier, we need to have some kind of marker for loading that tissue prior to our athletes just jumping back into higher intensity activities. So this is a low-cost test that can easily be implemented to assess the adductor strength after injury or during injury prevention screenings to try and supplement an athlete's strength program and identify deficits in any kind of like injury pre-screening that you might do. And I think overall it just gives us another tool in our tool belt to assess athletes or even general population and be able to kind of like guide our treatment interventions with people who suffer from these injuries.
Definitely. It's another way. If you have somebody who's coming in with an adductor strain, groin pain, even like medial knee discomfort, it's another lower extremity test that we can do that's a little bit more involved and it's a little bit more challenging than your traditional manual muscle testing. So if you have somebody, they're screening out well with their range of motion, they're able to tolerate some of your adductor manual muscle testing, maybe they're able to do some sort of objective data if you have an inline dynamometry or you have some sort of handheld dynamometry where you can get an actual quantitative score over magnitude and force production with adductors in isolation. This will give you another piece of the puzzle. What is their endurance with the adductor muscle group? What is their strength in relation to their body weight? I think that's another thing to keep in mind here. This was a relatively similar group of individuals. You have all elite level soccer players. They're probably going to have roughly similar body types. You're probably not having people like on a football team where they could range from 160 pounds to 350 pounds. So I think with this, it's another way to capture adduction strength. There's an endurance component to it, and it's strength relative to their body weight, through an isotonic motion with some sort of dynamic as opposed to a static component to it. So I like the analogy that you had used where it's similar to like the anterior step down that we have for the knee. Somebody comes in with anterior knee pain, or they're coming in post-operatively and we're looking at quad deficits from a functional standpoint. There's a lot of different things that factor into performance on an anterior step down test. And for those unfamiliar, you're standing on a block 6 to 8 inches, depending on the literature and the height of the athlete you're working with. And they're essentially doing an anterior heel tap. So it's like a mini step down, mimicking going up and down steps. And with that, balance can be a limiting factor. Ankle dorsiflexion can be a limiting factor. Coordination of just all of the moving pieces of ankle, knee, and hip can be a limiting factor. Or knee extension strength can be a limiting factor. So same thing with this. This is a higher level adduction strength test, but it's assuming we've already done the basics. We've already done our table testing. If we have the ability to do isometric testing and capture some sort of data point with that, with dynamometry, we can do that as well. And then this gives us a more dynamic test. Ways that you can modify this. And you'd be straying from the protocol, the BAPT, but there's nothing to say that you can't shorten the lever arm. And maybe you have them go from it with the position around like their knee or their thigh on the bench as opposed to their ankle as an introduction to this. So it's a way that you can help with exercise programming. It's a way that you can benchmark their current status. This did show some sort of correlation between athletes, their performance on this test, and their injury history or future injury. But it wasn't extremely conclusive. But I do think it is something that gives you a little bit more data with that. Tyler, any final parting thoughts on your end from this article?
No, I think we hit on everything there. Yeah, I think that's about it for me.
Perfect. If you like this episode, please share, like, and subscribe. Stay tuned for our next episode. And you are listening to the Strength and Knowledge Podcast. This is Dr. Zach Baker, Dr. Tyler Betteridge. Thank you for listening.